My name is Cindy Buck. I'm a nursing student at Winston-Salem State University. I will be conducting a neurological assessment on my patient today. My patient is Anna Haywood. Ms. Haywood, I need your permission to record this assessment and post it for educational purposes. Do I have your permission?
Yes, ma'am.
Okay. Can you tell me your full name and your date of birth?
Anna Jolene Haywood, 11/17/93.
Okay. Ms. Haywood, are you allergic to anything?
No, ma'am.
Do you have any unusual headaches, frequent headaches, severe headaches?
No, ma'am.
Have you ever had a head injury?
No, ma'am.
Do you have dizziness or vertigo?
No, ma'am.
Have you ever had a seizure?
No, ma'am.
Do you ever have shakes or tremors to your hands or your face?
No, ma'am.
Do you have any weakness or problem moving any body part?
No, ma'am.
Do you have any problems with coordination or balance?
No, ma'am.
Any numbness or tingling to any part of your body?
No, ma'am.
Do you have any problems swallowing?
No, ma'am.
Any difficulty speaking?
No, ma'am.
Do you have a past medical history of stroke, spinal cord injury, meningitis, or encephalitis?
No, ma'am.
Are you exposed to any environmental or occupational hazards such as lead, cleaning solvents, chemicals, or insecticides?
No, ma'am.
Are you currently taking any medications?
No, ma'am.
Do you smoke?
No, ma'am.
Do you drink alcohol?
No, ma'am.
Do you use any recreational drugs?
No, ma'am.
Okay. I will begin the cranial nerve assessment. Cranial nerve number 1 is the olfactory nerve. This is not routinely tested unless the patient reports a loss of smell, has had a head trauma, or has had some mental status change. Ms. Haywood, have you noticed any changes in your smell recently?
No, ma'am.
Okay. Cranial nerve number 2 is the optic nerve. This tests for visual acuity and we'll be testing visual fields. Ms. Haywood, I'll be shining a light in your eye. Take a look at your optic disc and ocular fundus. Just look straight ahead. Okay. Okay. The optic disc is yellow, orange, and round in both eyes. Okay, just look straight ahead. I'm going to check her pupils. Pupils are equal, round, and reactive. All right, if you will look up here at my light, don't move your head. Look with your eyes. Out here, down here, up here, out here, down here. Okay, that checks the cardinal position of gaze. This is under the cranial nerve assessment for 3, 4, and 6. This is the oculomotor, trochlear, and abducens. Her eyes were equal, round, and reactive to light and accommodation. Now I will assess her vision by using a Snellen eye chart, which I have posted on the far wall. Ms. Haywood, if you could cover your right eye and read whichever line is the clearest to you. If you can read me the letters.
D, E, F, P, O, T, E, C.
Very good. If you'll cover your left eye and read whatever line you can read clearly.
D, E, F, P, O, T, E, C.
Very good. All right, cranial nerve number 5 is the trigeminal nerve. This assesses the muscles of mastication. I will be palpating the temporal and the setter muscles. Okay, can you open and close your mouth? Okay, clench your jaw. Don't let me open. Very good. Muscles are strong and symmetrical. I will now be checking the sensory function. I will be touching with a cotton ball, and you tell me now when you feel it. Okay, close your eyes.
Now. 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 Now.
Very good. Okay. These shows the divisions of the nerve, the ophthalmic, maxillary, and mandibular, and everything is grossly intact. I will now move on to cranial nerve number 7, which is the facial nerve. This shows mobility and facial symmetry. If you could smile, Ms. Haywood, frown, show me your teeth, close your eyes, raise your eyebrows, okay. Don't let me open. All right, puff out your cheeks. Okay, very good. Cranial nerve number 8 is the acoustic nerve. This is the ability to hear in normal conversation, and as you can tell throughout this assessment, Ms. Haywood has no problems hearing. Ms. Haywood, I will now be doing a whisper test. I will be whispering a 2-syllable word in your ear, and you repeat whatever word you hear.
Okay. Seesaw. Cupcake.
Very good. Cranial nerve number 9 and 10 is the glossopharyngeal and the vagus nerve. I will be using the tongue blade and my light, and I will be assessing the tongue, soft palate, and the tonsils and uvula. All right. Tongue out, say ah. Okay. The soft palate rises at midline. The tonsillar pillars are move medially, and I will now check for gag reflex. All right. Okay, very good. Gag reflex is intact. Throughout this assessment, you can tell her voice is smooth and not strained, so we have no problems there. Cranial nerve 11 is the spinal accessory nerve. This, I will be examining the sternomastoid and trapezius muscles for equal size and strength. Okay, if you can turn your head to the left against my hand. Okay, now turn to the right. All right, raise your shoulders. Very good. Okay, those muscles are equally strong on both sides. Cranial nerve number 12 is a hypoglossal. This will be inspecting the tongue. If you can stick your tongue out. I see no wasting or tremors. Tongue protrusion is midline. If you can repeat the following words after me. Light, tight,
Sorry.
light, tight, dynamite.
Light, tight, dynamite.
The letters L, T, D, and N are clear and distinct. This completes the cranial nerve assessment. I will be moving on to the motor system. I'll be examining muscle groups for strength, tone, and any involuntary muscle movement. First, I will do passive range of motion. Just relax your arm. Let me move freely. Okay, relax this arm. Okay, and legs. Okay. Just good muscle tone to all the major muscle groups. Okay. I saw no involuntary muscle movement. I will now do an additional part of the assessment. If you can take my hands. All right, push against me. All right, pull back. Very good. Uncross your legs. Pull your feet up, toes to your nose. Push down like a gas pedal. Okay, all of those are intact. I'll now assess gait and balance. Ms. Haywood, if you can stand up here at the end of the bed, and if you can walk normally down to that end of the bed and back. Okay, if you can walk heel to toe, down and back. Very good. If you can walk on your heels. Now walk on your tiptoes. Okay, if you can come stand right here in front of the bed for me. All right. Put your feet together. Arms down to your sides, eyes closed. We will check for 20 seconds. This is doing a Romberg test. This is ensure that she has no problems with her balance. Okay, Ms. Haywood. Next, I'll let you have a seat. Okay. Now, without using your arms, can you get to a standing position? Very good. Okay. Have a seat once again. Place your hands on your knees with your palms down. Okay, I need you to pat your knees 3 or 4 times and then flip your hands over to the back of your hands and pat your knees 3 or 4 times. Okay, a little faster. Very good. Now I need you to take your thumb, touch it to each one of your fingers on your right hand, and back, and your left hand. Very good. Now I'm going to hold up a finger. I want you to touch my finger with your finger and then touch your nose. Okay, up here, down here, here, and down here. Okay. All right, now I want you to close your eyes, stretch your arms out to your sides, and bring your finger in and touch the tip of your nose. All right, left hand. Very good. You can open your eyes. Okay, now I will be touching you with 2 different objects. I need you to tell me if the object is sharp or dull. Okay? Close your eyes for me.
Sharp. Dull. Sharp. Dull. Sharp. Sharp.
Okay, very good. Now I will be doing a light touch test. You can close your eyes, and when you feel me touch, say yes.
Yes. Yes. Yes. Yes. Yes. Yes.
Okay, very good. Next, I will be doing steranosis. This is where I place a familiar object in your hand, and you try to identify the object. Open your right hand, close your eyes, close your hand. What is
key?
it? Yes. Left hand. Close your hand.
Paper clip.
Very good. Next, I will be doing graphesthesia. This is where I trace a number in the palm of your hand, and you tell me which number I am tracing. Close your eyes.
6.
Very good. Left hand.
3.
Very good. Okay, open your eyes. I will be doing 2-point discrimination at this time. I will apply points to your arm, and I will change the distance between the points. You tell me when you no longer feel 2 points where it becomes 1. Close your eyes.
2. 2. 1.
Okay. Left arm.
2. 2. 1.
Very good. I was touching at all points with 2, and it's a normal response. As they become closer together, the patient only feels 1 point. Okay, now I'm going to do extinction. This is where I'm going to touch you on both sides, and you tell me how many sensations you feel.
2. 2. 2. 2.
Okay, very good. Point location. This is where I'm going to touch you a point on your skin, and I want you with your finger to touch the exact same spot.
Okay.
Okay, close your eyes. Very good. Okay, very good, Ms. Haywood. I found no abnormalities in the assessment so far. I will check your reflexes at this time. I'm going to check your biceps reflex. If you can just relax your arm for me. Just drape it over mine. Thank you. Good muscle contraction to the biceps. Forward arm flexion. Same over here. Relax your arm. Good bicep flexion. Okay, now I will check her triceps. Reflex, just relax your arm onto mine. Okay, this side. Relax your arm. Very good. I will be checking the quadriceps reflex. Just relax your legs. Very good. And the plantar reflexes. Very good. All reflexes intact. That concludes our neurological assessment. There were no abnormalities throughout this assessment. Thank you, Ms. Haywood, for your participation.